in Bonn. So PEGNet, to give you just a flavor, is a network with a core mission of fostering the exchange between researchers, policymakers, and development practitioners. And we have various activities around the year, including an annual conference. This year we have even two, because last year we couldn't have the conference due to COVID. One in March on climate change, and which is in Germany, or is online basically, and one hopefully in September in presence in Uganda, in Kampala, on fragile states. So this is one of our activities, and we also have other activities such as a policy brief series and regular workshops like this one. And I'm quite confident that the event today is well in line with PEGNet's mission to get an exchange between policymakers and researchers ongoing. So I think we have an excellent lineup of speakers with very interesting and policy relevant topics. And at the same time, at least according to our registration list, we have a nice mix of participants, including researchers, members of international institutions, and also development practitioners. And without further ado, I would like to head over to Christoph Struppart, who's going to moderate the whole day or the whole afternoon, and he's from the German Development Institute. Christoph, please go ahead.
Thank you, Rainer, for the kind introduction. Yes, my name is Christoph, and I will moderate the workshop today. Yeah, I'm a researcher at the German Development Institute, working in the field of social protection and health. And yeah, I will get some support as well, also from my colleague Markus Löwe, who is a senior researcher at the German Development Institute as well. And he is helping me, especially with the chat. So when there are questions in the chat, he will read them out or let me know if there's anything that I have not seen. Before we start, I would like to let you know that we are recording the workshop. And if there are any questions or you don't want to be included, maybe with your question or remark that you will raise later on, please let us know after the workshop. Yeah, it's really great to see so many participants, and yeah, let me briefly introduce you about the idea of the workshop. And yeah, we all know that the COVID-19 pandemic has severe negative socioeconomic impacts, in particular on those that are poor. And we also know that many countries have extended their social protection schemes as a response to the crisis. But there's still, in a way, relatively little evidence on the impacts of the adaptation of social protection programs and also social protection responses to the COVID-19 pandemic and also the lockdown policies. And yeah, so today's workshop is in a bit, the aim is a bit to show the latest evidence on the topic and maybe close a bit this kind of knowledge gap, you know? And we are very happy to have 4 distinguished speakers today with us that will present us their work on the topic. And I'm very happy also to have that we have speakers that will also focus a bit on very established social protection programs, namely the Productive Safety Net program in Ethiopia and the Employment Guarantee program in India. And I think we will learn from their presentations how these programs have been during the COVID-19 pandemic, and maybe also learn about the impacts of the adaptations. And furthermore, we will have also 2 papers that focus on other social protection instruments. One will focus on pensions, and one will focus on unconditional cash transfers. And here, the two papers focus also on very particular groups that have been also heavily affected by the pandemic, but also by the lockdown policies, namely the elderly and also small businesses in the informal sector. And you know that the informal sector has been, in particular, of course, in developing countries, has been affected very, very heavily. And yeah, we are very happy to have one speaker that will focus on businesses in the informal sector today. And of course, in the end, after we have seen all the presentations, we would like to discuss with you a bit what kind of social protection policies have been most effective, and also which ones could improve the resilience of people in low and middle income countries, maybe in the future. So before we will start with the presentations, I would like to briefly explain a bit the structure of the workshop. So we will first have the 4 presentations, and as a first part, and then we have a second part, and the second part is then a question and answer session and discussion. And each presenter, each speaker will have 15 minutes to present their work, their paper. And of course, if you have any questions, you can use the chat, and you can type in the question there, and we will try to consider all questions later on in the Q&A session. And but of course, later in the Q&A session, we will also allow that you can personally ask a question. And when there's any question on, like, if you do not understand maybe a term in the presentation, so any question of clarification, please type the question also in the chat, and I will always have an eye on the chat, and I will try to get back to one of the speakers after his or her presentation in order to clarify then and get an answer from the speaker on the term. And yes, maybe we can start with our. I think we can start with the first presentation. As I said, we are very happy to have 4 speakers with us, and the first presentation will be from Garima Sharma, and Garima is in her 4th year of her PhD in economics at MIT. And in her studies, she focused on labor markets and social protection programs in developing countries. And before she joined MIT, she worked on social protection at the World Bank and with Jaypal in India. And she will present the paper, "Did Pensions Protect the Elderly from the Impacts of COVID?" And the paper is co-authored by Esther Duflo and Abhijit Banyari. And yeah, Garima, it's great to have you here, and maybe you can share your screen that we can see your presentation, and the floor is yours. Thanks.
Great, thank you. I just wanted to pop in to say hi before I have to rudely turn my video off because my internet is quite bad. Sorry. Are you able to see my screen?
Yes.
Okay, super. And do you now see it in full screen mode?
Yeah,
okay.
You can see it in full screen.
Great. So I will get started. I'm going to be talking about this paper that's looking at whether pensions helped protect the elderly from the negative impacts of COVID-19 in India. This is joint work with Abhijit, Esther, Erin, who I believe is here, Maddie, Frank, and Dr. Girija. So we know that in response to the pandemic, governments all across the world have started to transfer cash to different sections of their population, which is done both to encourage people to stay at home and effectively distance from others, but also to buffer some of the consumption losses that we know are occurring because of COVID. And in the set of transfers, pensions might be particularly useful because we know that they target the elderly who are at greater risk of health complications because of COVID, and particularly those who are living in poverty, who may also face greater economic risks because they're losing the livelihoods that they relied on prior to the pandemic. In this project, what we're looking at is whether pensions given to the subset of elderly living in poverty protects them from the negative health and economic consequences of COVID, and if yes, then how? For example, does it enable them to access better consumption, healthcare in a more timely fashion, distance more effectively, or something else? And the setting for this study is going to be Tamil Nadu, which is a state in the southern part of India. It's aging quite rapidly, and those aged over 60 are slated to be over a fifth of the state's population in the next 15 years or so. Now, Tamil Nadu runs an old age pensions program for elderly living in poverty, wherein it transfers on a monthly basis about $50 to these people. The experiment that we've run randomizes access to these pensions. And this was, by the way, running pre-pandemic. When the pandemic happened, we decided to also study how it might be affecting people's ability to cope with COVID. In terms of the sample, we first identified elders who were eligible for but not receiving the pension through a census exercise in 5 districts of Tamil Nadu. To be eligible, people had to be over 60 years of age. They had to not own too many assets, and they had to have no credible sources of income. For example, they couldn't have a male earning member in the household or have had to be relying on things like begging. In total, we identified about 913 households with over 1,000 elders, of which we randomized 457 into the treatment group and 456 into the control group. The treatment itself gave the names of these people to the government to expedite for pension receipt. And as of the start of COVID, so in April 2020, about half of these people had been approved by the government to start receiving the pension. In terms of when they actually started receiving it, it was starting in 2019 in different batches, but the largest share of them, over 65%, started getting it only in May/June of 2020, so after the pandemic started. To give you a sense of the baseline characteristics of these households from 2019, the first 2 columns is a study sample. The third column is other elders who are deemed ineligible for receiving the OAP. So households that were eligible were poorer by about 30% than elders living in households with others who were deemed ineligible for the OAP. They were also more food insecure, having had to skip meals in the past month at much higher rates. They also had lower rates of, for example, owning their homes or having phones. So they were poorer than other elders in the state on average. When the pandemic happened, the government of India announced a national lockdown starting in March. And we wanted to know how it is that these households were faring. So we went in and surveyed them over the phone in 3 waves. The first of which happened in April, then in July, and then the final one is currently ongoing. Now, because most of these households had only started getting the pension in May or June, think of July as being the post-pension period for the treated group, and April as being the pre-pension period for the treated, as well as the control group. In total, we reach about 570 people from our sample in these phone surveys, but attrition is balanced between the control and treated group. And what we're interested in looking at is their food security, mental health, access to healthcare, whether their family is supporting them during the pandemic, and their ability to socially distance from others. This is the first stage. So what this shows is that as of July, about 6% of the control group is receiving the pension, and there is this positive effect of the treatment on people reporting having received the pension in the last month. The compliance with treatment is not perfect, but about 23 percentage points more elders in the treated group are receiving the pension as of July. In terms of our empirical strategy, we will show you both the reduced form effect of being in the treated group on these outcome indices related to food security, mental health, and so on. And because we know that compliance to treatment was not perfect, we'll also show you the IV estimate, which scales the reduced form by this first stage of people actually receiving the pension as a consequence of being in treatment. And because we have a rich set of baseline characteristics for these people, we are able to use a double lasso, which I'm happy to talk about if people are interested, to identify controls to include in our specifications to increase our precision by a bit. Okay, so these are the effects on food security. The picture on the left is the individual outcomes that we are looking at. The dots in dark are for July, the dots in light colors are for April. Red is the treated group and blue is the control group. And by the way, a higher indication here is positive. So people have more resources for food if the dots are more to the right. Okay, so what we see here is that in April, about over 50% of people did not have enough access to food for the next week. But that over time, this worsens for the control group. So only about 35% of them in July say they have enough resources for food in the next week. For the treated group, which started receiving the pension, the food security is much more stable over time. And in the table, we see that this is in fact statistically significantly different between the control and treated group. So it seems that pensions enable the treated group to have higher food security in July during the course of the pandemic. That's one of the main conclusions of our study. In terms of medical access, we find both groups needing doctors at much higher rates in July than April, and also being able to access medical care at greater rates in July than in April. But the pension itself did not have a significant impact on people's ability to access medical care. The third thing that we look at is mental health. And we find for both treated as well as the control group that mental health is deteriorating over time between April and July. They're more likely to be lonely, less likely to feel hopeful or safe. But again, no effect of the pension itself on mental health. Something we do find, which is quite interesting, is that the treated group, so those that were receiving the pension, are more likely to be supported by their family members during the course of the pandemic than members of the control group. So at baseline, of course, a majority of these people, so over 61%, had been supported by their families. And we see that during the course of the pandemic, the treated group are much more likely to continue to be financially supported by their family members. And of course, we don't know exactly why this might be, but one might speculate that because the pension is permanent and is going to last over the course of their lives, family members might have a greater incentive to try to keep these people alive for longer. Exactly what the nature of this family support is something that we're in the process of exploring in this final survey that we are conducting. Okay, and then finally, we've looked at measures of social distancing, wherein we find that the treated group is less likely to report either working during the pandemic or intending to go back to work. In terms of social interaction, also the treated group is less likely to visit others or be visited by others. And perhaps this is because some of the family support that they seem to be getting is in kind. So maybe the family is shopping on their behalf, bringing them things. Again, something we're exploring right now. This effect on social distancing is not statistically significant in this sample, but there's some indication that in this final survey that we've done with a much larger sample, that this effect might be statistically significant. All right. So in conclusion, it seems that these pensions enabled the poorest elderly in Tamil Nadu to have greater rates of food security during the course of the pandemic. It also crowded in family support, with those receiving pensions more likely to continue to be financially supported by their families than the control group. And at least suggests that this is enabling them to more effectively socially distance from others, although that's not statistically significant in the sample that I showed you. We don't find effects on mental health or access to medical care. In the ongoing survey, we want to explore mortality and illness responses in much more detail, as well as think about possible public health ramifications. So is it the case that family members are more likely to go shopping for these elders? Are these elders able to hold off on economic activity for longer? And so on. To put these results a little bit in the context of what other people have found, our study is consistent with another one in Bolivia that studies the effects of a universal pension, wherein the authors also find positive effects on food security during the pandemic, which are largest among households that were the poorest at the start of the pandemic. We also find something quite similar in Tamil Nadu. There are these other studies that find positive effects of UBI, and I believe the cash transfer one will be presented soon, on hunger as well as on businesses. But because they find positive effects on commercial activity, we don't know exactly what the effects or what the implications are for public health. In contrast, what we seem to find in our study is that the elderly who are receiving pensions are able to distance more from others. And if we find that this is actually true in the larger sample that we're looking at, it would be in tune with what some economists seem to be calling for, which is lockdown policies wherein the elderly are isolated, but younger members continue on with their economic activities. Going forward, we think that our findings suggest the usefulness of having these quote-unquote pipelines. So social programs that are already in place that you can leverage to channel resources to particularly vulnerable households in times of crises. Okay, that is all that I had. So thank you very much.
Yeah, thank you very much, Garima, for the great presentation. Very interesting results. And I would like to, I have seen one question that is a question of clarification or a question of understanding, which is maybe important for the, in order to, it's on the eligibility criteria. It is on the eligibility criteria was the one does on eligibility criteria was that one does not live with working age household member of the sample there are still 24% of treated report living with such a member. Was these criteria will let there are targeting challenges. Yeah, we also can maybe push this question to the Q&A session, or when you have a very brief explanation on that, you can just step in. Otherwise, we will explain it later.
Yeah, sure. I'm happy to talk about this. So,
okay, great.
Eligibility was determined based on, we ran a census exercise in 2018 with a short survey that determined whether households were eligible or not. And then what I showed you were results from the baseline survey. So it's possible that between the initial listing exercise and the baseline survey in 2019, something about these household composition changed. That's probably what explains the imperfection in targeting. And by the way, this is not the only time. So as I said, only 51% of these households were actually approved by the government for receiving the pension. And that is exactly because of these eligibility changes that may have happened between our listing exercise and later.
Okay, I see. Good. Okay, then let's move on. Thank you very much again, Garima, for the presentation. As I said, we will have probably more questions than after we have seen all the presentations. So let's move on. Let's move to the next presentation. And our next speaker is Christian Eudiges, and he will present a paper also on India. Christian is the Director of Policy Research at Oxford Poverty and Human Development Initiative at the University of Oxford. And he holds a PhD in economics from Heidelberg University. And during his doctoral, his research focus was on evaluating welfare impacts of the India's Employment Guarantee Program and on measuring food security. And Christian is currently leading the outreach team in South Asia and many parts of Sub-Saharan Africa, supporting governments in building national multidimensional poverty indices. And he will present the paper Employment Guarantee During Times of COVID-19, Pro-Poor and Pro-Return Migrant. Yeah, Christian, it's great to have you here, and the floor is yours, or the online floor is yours.
Hi, I hope you can hear me.
Yeah, can hear you.
Thank you very much for the invitation, and thank you for all the participants for being here. It's a real pleasure to be presenting my work that developed over the summer, and it was great listening to you, Garima, and it's good to have all of you here in this session. It's a real pleasure. It's a way of coming home. I live in Oxford, but and I couldn't go home because of the lockdown, and I'm also from Germany by coincidence. So it's a pleasure to be here, and this work is co-authored and written with Sudha and Shri, who are both in India. I'm not sure they are listening. And we came up here, which is not really an RCT and not as empirical as Garima's work, but it's more of a snapshot and descriptive analysis of what happened in 2020 when the NAGA was expanded in India, the huge employment guarantee program. And I have a couple of slides. I hope I won't go overboard. It won't be too much, I think. The Mahatma Gandhi National Rural Employment Guarantee Act, and I will often refer to it as the NREGA or NAGA, guarantees 100 days of work to every person in rural areas willing to do unskilled manual labor at the minimum wage. And this has been so since 2006, when the NAGA was first rolled out in different phases all over the country. And as Garima, I'm citing Gentilini, who reports that in 2020, we in fact had more than 150 workfare programs of this kind, or variations of this kind in 2020, which also had been expanded during the lockdown measures that were in place. Now, the NAJA has been studied a lot over the past almost 15 years. And just to describe it briefly, and what's important for our study is it is a work program that is based on self-selection, that is ideally demand-driven. That means whenever workers demand work, they're entitled to receive this work. Now, many studies have shown that is actually mostly a supply-driven program where states organize works and laborers can come and work. And crucially, these are public works. It could be road construction, it could be useful assets that are being built. They should all happen within a 5-kilometer radius of the village within the rural areas. Now, many studies have shown that the NAJ can really be real benefit for people, especially for those that are suffering in the dry season and do not have any other means of income. And so we've seen huge wage increases due to the program. We have shown that it reduces poverty, it increases consumption expenditure, and Sudha and her colleagues have shown that the NAJ produces actually sustainable and very useful assets. And overall, this improves the livelihood of the poor and those at the margins. So overall, there is reason to expand the program and to have this program in place. And especially now in 2020, when perhaps the chief designer of the NAJ, Professor Dandora, says that we actually need 1 million work sites. And this was not only him who said that, but it was many people who said that during the lockdown, what everyone noticed was that there was a huge flow, sorry for the slide, of return migrants. So what happened in 2020 was that the lockdown happened in March 23, when it was announced, and very soon after, there was a huge flow of return migrants who had to go back to their villages or to the places where they came from. And this put all of them at risk, and this spurred a lot of research, of course, but then the demand for more work increased, and not only by professors, but actually by real people. And we see that in the data when we see that the person days demanded after the lockdown increased substantially after the lockdown, after the measures happened. And that was especially visible in April, May, all the way up to June. And we see that it's much, much higher than in the previous years. Normally, we see a spike in the dry season, which happens between April and June typically, and that is when the NAJ is very effective and has absorbed lots of labor. What we've seen in 2020, that the demand for work was even higher than before. And we see here too that the program responded, and these are monthly data for the previous years, all the way down to June 2011. We see that the actual person days increased also substantially after March 2020. So there was a huge expansion as a response to the lockdown measures and to the huge migration flows. But what we basically were wondering about was whether this expansion benefited those that were most in need. That means those districts at the highest rates, shares of poverty, and those that actually suffered the most from the huge backflow of return migrants. So we had a very simple question and wanted to describe that. And for this purpose, we used NAJ data from the website. from the NIJ website, which has monthly data. It's a bit difficult to navigate, but we managed to basically scrape data from this website and the portal. And then we use two data sources of our key variables, poverty and migration. For poverty, we looked at multidimensional poverty. And since we have data for 2015-16, this was quite nice to use. The latest consumption expenditure data, which we normally use to compute monetary poverty, was only available for 2011. So multidimensional poverty has many other advantages. It encompasses education, health, and living standards, and anyone deprived in 1/3 of the 10 indicators would be considered multidimensionally poor. And we computed this at the district level using the Alcala-Foster method and following a paper of mine and co-authors at OFI, including Sabina. And we know that India had seen huge poverty reduction over the 10 years prior to 2015. 271 million people moved out of poverty within a decade, which was a huge success. However, we know, and I will show that there are still many pockets of poverty, even in states that are doing better than others. For migration, we do not have, let's call it proper migration data. So we do not know how many migrants turned back to each district. So we relied on the data computed by Clément and Baer, who showed this in an Ideas for India article using NSS data and census data from 2011. And we calculate, doing so, he calculated and we then calculated the total out-migration numbers and shares in each district. So we had two measures, poverty and using multidimensional poverty and migration, using out-migration as computed by Clément and Baer, both at the district level. And you see the data are outdated, so but that was the best data we could use. We used them from 15-16 and 2011 respectively. Now, to start with, one common exercise to check whether a program is doing well, such as the employment guarantee, is to look at administrative rationing. And that is basically a measure of unmet demand. And that is the proportion of households that demanded work but did not receive work as a proportion of all of them. So we see that this proportion, and we plotted for two groups. One for only the groups, and that is the darker one, the top one. One only for those that are part of the highest migration districts, and the second one for the lowest. And we use terciles to determine districts that have a high proportion of migrants and a lower one. So the top tercile is the darker one, and we see that those with an increasing poverty rate also saw an increasing rationing rate. And we see that too for the other one, but at lower levels. So that's really, that was our insight and something we wondered about. And just seeing this helped us to think about this further. I mentioned the two measures, and we plotted them, and we showed that poverty and migration rates are not necessarily going hand in hand. For one, on the right map, you'll see that and here we're not, I'm not plotting the rates, but actually the shares of the number of poor to the total all India number of poor. And the same with out migrants. On the left map, we plot the shares of out migrants to total out migrants in India. And we see that the darker regions on the poverty map are mostly in Uttar Pradesh, Bihar, and Jharkhand, West Bengal, and then some of them are scattered across the country, from Rajasthan down to Andhra Pradesh, and then some in Maharashtra. But these are not the rates; these are the shares, and this indicates where the highest need is, in a way, in terms of number of poor people that need or are most likely in need of an employment guarantee program. Now, the out-migration shares on the left map show a slightly different picture. And we see that the highest shares are on the western coast and within Maharashtra and also within Andhra Pradesh, and then again scattered across UP and MP and also Jharkhand. So these two.
Christian, you have 3 minutes. Sorry.
Okay. Yeah. So we then wondered how we could basically show how the NIJ expanded. And we looked at two measures, the extensive margin and the intensive margin. And the extensive margin tells us how many new people, new households receive employment, and the intensive margin tells us how many more days do employed households receive. And again, looking at the shares as the two of them make up for the total expansion, we see that the extensive margin was very high in UP and in that part of India, whereas it was almost going down in southern India or Maharashtra. And in Maharashtra, we see that the intensive margin was very high, but this means that it didn't really extend to many more people. That means many people who received the program before might have received a few more days, yet we know in Maharashtra the employment guarantee was not picking up at all, so just extending the program there at very low levels did not help. And that is confirmed by this map, and I hope I can get 2 minutes more, because we see that the major expansion took place in districts that had traditionally been doing better than others. And these are in Andhra Pradesh, Chhattisgarh, and Jharkhand. Jharkhand and Rajasthan. And these districts have person days per rural household, which are up to 20 or even more than 20, which is really, really high. Now, simple regression analysis, starting with simple bubble plots, would show us that there's not much of a correlation between the extension of the expansion on the incentive margin with poverty or migration. A simple regression analysis showed us that there's hardly any correlation. There's no correlation between the expansion of NAGA and poverty and out-migration. So the expansion has taken place in districts that already saw high percentage per rural households. These were not necessarily the poorest, and districts that account for high out-migration shares are not really expanding the program as we would have hoped. So in a way, the program reinforced itself, and we have seen that the person days expansion happened in districts that have been doing better in this program than others before. So there are many recommendations. Maybe we can discuss them in the discussion. A major one would be, of course, to implement the program better, to even expand it to more days, and to also include urban guarantee programs that have been discussed. And we are currently doing more research and trying to show and investigate whether there was actually a crowding out of women in this employment guarantee expansion. So thank you very much. I hope this was useful and insightful.
Yes, thank you, Christian. It was very useful. Rich data that you have. I also like that you use many maps in order to and very interesting. And you also had a reflection on gender, and expect that you also will look into gender-specific effects maybe in the future, but maybe we can discuss it then in the Q&A session. And yeah, thank you again. But let's move on to the next presentation. The next presentation will be by Kevin Donovan. And Kevin Donovan is an assistant professor of economics at Yale School of Management. And his work focuses on constraints to microenterprises growth in developing countries, and the role of labor market frictions in limiting employment opportunities for the urban poor. And he will present the paper Cash Transfers as a Response to COVID-19, Experimental Evidence from Kenya. And it's great to have you here, Kevin. The floor is yours. And yeah, it's, as I said, very important also to see how cash transfers maybe can support, in particular, businesses in the informal sector. Thanks.
There we go. Okay, great. So you can hear me and see my slides then. Terrific, great. So thanks so much for having me. This is joint work with Wyatt Brooks, Terry Johnson, and Jackie Aridi. And, you know, I suppose given that we're at this workshop, I don't have to say too much on motivation, but just to sort of focus this paper a little bit, small businesses, especially in developing countries run by the poor, are at particular risk during COVID-19. And I'm going to cite the exact same paper that we've seen cited in the first two here to suggest that cash transfers seem to be a popular policy response. But because we're sort of working through the policy at the same time as we're trying to get evidence, there hasn't been much evidence yet on cash transfers to small businesses, which is going to leave a number of policy relevant questions still outstanding. And so what I'm going to talk about today is a program that we ran in which we randomized unconditional cash transfers to female-run microenterprises in Dandora, Kenya. So I'll talk a little bit about Dandora, but Dandora is a slum outside Nairobi. The cash was equal to about 1 month of average profit in normal times, delivered lump sum via mobile money. And we timed the payments to basically right at the start of the crisis in Kenya, right as the caseload started to grow exponentially in May 2020. And I think something that's useful to point out up front is that this is a group where policy hasn't quite seemed to have reached them. So when we talked to people in May, only 17% of them had claimed to receive any benefit from the government. Only 5% had claimed to receive any benefit from any NGO. And then we're going to study the impact of this one-time cash transfer as the crisis expands in Nairobi through the summer. So just in case I don't get a chance to finish, let me just make a couple points here, which is that the economic, sorry, am I frozen?
Yeah, your video seems to be off, so there seems to be a connection problem. But
the slides are still.
I think your slides. Can you move one slide?
Yeah,
or move the slides.
I'm going forward in my slides.
Okay, because here it seems to be frozen.
Okay, so let me take a quick timeout then.
Maybe you can stop sharing your screen and then start sharing it again.
Oh. All right, so if you can still hear.
We can hear you, yeah. Kevin? Oh, no, it seems to be, there seems to be a connection problem. Okay. Kevin, can you hear us? No. Okay. Yeah, maybe we will wait until, so maybe we will go, because we still have one presenter on our list, and maybe Kevin's connection will improve over time. Maybe we can just go ahead and maybe Kevin, because he was very at the very beginning of his presentation, we can go ahead and see the next presentation. And this presentation is from Kibram Tafire. Kibram, are you here? Are you around?
Yeah, I'm here.
Hopefully Kevin soon.
Kind of small.
Yeah. He's back.
Okay, great. So would you like to continue, or so you have
Sure. I'll continue, turn my video off, and I've got my timer running, so I will keep us on time too.
Okay.
All right, sorry about that. Let me, if I can be allowed to share my screen, I'll keep going here.
Okay.
Okay.
Okay, yeah, we are back.
Great. Okay. I'm really sorry about that. I have no idea what happened. Okay. Yeah. So what are we going to find now? Good thing I put these results up front. What are we going to find? We're going to find that the economic enthusiasm for these unconditional cash transfers is indeed warranted in the sense that profit, inventory, household food expenditures all increase. And just to give you a sense of that scale, it's going to recoup about 1/3 of the profit decline we observe at the beginning of 2020. But at the same time, we're going to argue that there's some caution warranted in terms of public health, in particular because delivering cash to these small businesses generates a massive reopening of firms that closed during the initial shutdowns earlier in the year. Now, the last part of this is going to be thinking through the trade-offs there. And in particular, if people spend more on PPE, so masks, hand sanitizers, or if they change management practices, maybe the public health concern is perhaps less than it otherwise would be. And indeed, that's exactly what we find. We find mitigation of this public health risk through better firm health practices, enforcing social distancing, enforcing mask wearing in your stores, and in terms of spending that they're making on these health-related issues or products. But in particular, one of the things I'll return to at the end is that the people who respond to the treatment with better mitigation, that depends critically on what people believe the health risks are at baseline. And so we're going to think about that in terms of complementary policy interventions, such as information to provide to people. All right, so why don't I just skip this part? Dandora is a slum outside owners for a variety of reasons, but this is a group that's particularly vulnerable to the COVID downturn. And just to give you a sense of what we're picking up here, this dashed line is a set of is profitability for a set of firms that we tracked earlier in the 4 or 5 years earlier, starting in late 2014 through April 2016. So this is again women in Dandora running small businesses. What I've plotted in the solid line here is our current data collection, which starts in late 2019 through early 2020. And what you can see is that in late 2014 and late 2019, profit looks quite similar. And then you can see this massive decline in profitability among these firms. So the first case in Kenya is in March. That's where a lot of the initial government policy response is as well. And what this ends up as roughly is that these women are earning about $2 per day in January 2020. And just a few months later, that drops to $1 a day. So this is the initial contraction. And then what we're going to do is we're going to come in and deliver cash to test whether, that helps these women sort of get out of that contraction. So just for some sense, we're going to sample 800 women that we drew from a much larger baseline survey that we had been conducting for a separate experiment. And then we're going to deliver 5,000 shillings to the treatment group via M-Pesa. That's roughly equal to about a month of profit. The control group gets 500 shillings. That's just to pay them because we're going to be calling them on the phone over and over again. And so this is a timeline here that I've overlaid with the WHO cumulative caseload. These shaded areas here are where we're collecting data. You can see the major government responses are here in mid-March. Our cash is delivered on May 12th, and that's right before the big run-up in cases that we observe. All right, so the empirical specification is pretty standard. And I'm just going to show you average effects for the purposes of this short talk. So what do we find? At least in terms of the economic benefits, there seems to be quite a bit of benefit. Profit goes up for the average firm by about 40%. And what I'm showing you here is the average profit for the control firm. This is the average profit for the treatment firm. And then the number I've put here is the treatment effect. This is saying profit goes up by 315 shillings over a base of 786. It's statistically significant at 1%. So profit goes up by about 40%. Food expenditures go up by about 7%. And so the economic benefits do seem to be there. But if you're looking for the public health benefits to sort of come for free, that does not seem to be what's happening. So we in fact see more firms operating after they get this cash, right? And so that sort of goes against a little bit this idea that maybe we can give people cash and then they'll use that to shut down their businesses instead of taking the public health risk. So what we want to think about then is what's going on? Why do we see this trade-off? How should we think about it? So the first thing I'm going to do is I'm going to use our two data points pre-treatment, one in January and one in May, of which the government response is in the middle. And we know that this is a big shock because in fact, 19% of the firms that we survey in January are closed in May. So what we're going to ask is, depending on the size of that initial shock, depending on whether your business had to close sometime in early 2020, how does our treatment differ depending on whether you were closed or open? And what we see when we do that is that average effect of the slightly higher number of firms operating is coming from the fact that this treatment induces a massive reopening of closed firms. So some of the firms who get the cash but were closed in May just open on their own. But once we give them this month worth of cash, almost everybody opens up. There's a bit of a decline for those that remain open. So maybe there is some of this shutdown is luxury type idea, but it's absolutely swamped by the fact that these firms are reopening. And of course, then because of that, you end up seeing a much larger treatment effect in terms of profitability for firms that were closed in May than those that were open. Okay, so that's our first point. There seems to be this important interaction between the public health aspects and the economic benefits. And so what we want to think about is if the treatment is changing these things, might it also make it easier for firms to mitigate the effect? Might loosening borrowing constraints with cash allow them to buy more sanitizer, more soap, more masks, those types of things? And indeed, that's exactly what we find. So when we look at PPE spending, we see about a 15% increase in response to the cash. We can do something similar with what we call health management practices. I'm happy to talk more about what these are, but this is an index of practices that we think are related to, better public health. We see a similar increase there. Now, the last part of this is trying to figure out exactly who these people are. Who are the people that are driving these mitigating forces through PPE spending and better practices? And so what we're going to do is we're going to use the fact that at baseline, we asked people what they thought the mortality risk of COVID was. Now, one thing that'll jump out at you here is that around half of the people said that it was roughly the same mortality risk of getting COVID as Ebola. I don't know exactly what the mortality risk of COVID is. I think that's still an outstanding question. But I think one thing we can sort of agree on is that it's more deadly than the flu. And so we're going to take people, this is around 20% of people who say that the mortality risk of COVID is equal to or less than the flu. And when we break up that PPE spending based on the type of beliefs that people have, you can see it's all coming from people who have these relatively high beliefs. If we look at people who think that there's a low mortality risk from COVID, there's no difference between the control and the treatment. The cash does not induce any changes in terms of their PPE spending or in fact their management practices. It's all coming from these high belief people. So in my last 30 seconds, let me try and conclude and maybe say something broader about policy and what we've gained from this. So I think in general, the urban poor, even in the best of times, are an extremely difficult group to reach with policy. They tend to be informal, they tend to be in slums. So for example, one of the things that the Kenyan government did was suspend listing of delinquent payments on loans for micro and small businesses, which seems like a perfectly reasonable policy in response to COVID. Why does that not reach our sample? It turns out only 8% of them had taken a formal loan at any point in the last year. So there's just this lack of connection between what the government can do in a more formal way and what the types of people who are most likely at risk. This becomes an even bigger issue when we need speed. So we sort of take away two things from our study and how we think about a broader crisis. One is that a lot of the infrastructure required to move quickly in a time like this, I think is already there. For us, that's mobile money, right? We planned and delivered a project in a couple months, just leveraging existing infrastructure to use for our purposes. And then the other thing I think is really important here is that we spent a lot of time during this crisis thinking about targeting, which I think is certainly an important issue. But one of the things we know about the urban poor is that they tend to be geographically concentrated already. And so when we're debating this speed versus targeting issue in a crisis like this, our preference and our results here seem to suggest that you're not going to get a lot of leakage, at least among the urban poor, and maybe we should balance more towards speed than spending more time making sure it gets to exactly the 10% of the poorest people. Finally, another thing that comes out of this, and I'll end here, is that on their own, these unconditional cash transfers don't seem to be enough, at least in the way that we've structured them. Why? Well, for example, one of the things our results suggest is that maybe complementary information might be useful here, right? So I showed you that beliefs play an important role in these mitigating factors. So combining cash and information might allow to induce safer reopening without sacrificing those economic gains. And then finally, of course, there are issues about the long run implications of short run transfers like this. That's something we're working on now, and we plan to follow up over the next couple of years with these firms to have something more to say. So thank you. I really apologize for the technical issues, but I'll stop there. Thanks.
Thank you, Kevin, for the great presentation, and even with the technical problems. Thank you very much. So just 3 minutes more. Yeah, thank you for your very clear and concise presentation of your cash transfer experiment in Kenya. And yeah, given our time limit, I think we will move directly to our last presentation, and we will stay in sub-Saharan Africa. We will move to Ethiopia, and as I have discussed in the introduction, this paper is on the productive safety net program in Ethiopia, and we have Kibrom Tafere here. Kibrom is an economist in the development research group at the World Bank, and he received his PhD from Cornell University, and his current research focuses on access and infrastructure in developing countries and their impacts on health, education, agricultural productivity, and food security. And Kibram will present the paper COVID-19 and Food Security in Ethiopia, Do Social Protection Programs Protect? Kibram, it's a pleasure to have you and learn about your work and your paper.
Thank you. So, the first option I would imagine is share, right? Mind desktop. So it's the German thing again.
Yeah, exactly.
Okay. All right. Okay, let's see. Oh, perfect. Got it. Okay.
Yeah.
Okay, you can see my screen, I hope, right?
Yes, we can see it.
Perfect. Okay, thank you very much for the invite. This is a joint work with Kibram Abai and Gush Burhani at IFPRI and John Hodnott at Cornell University. So in this presentation, I'll talk to you about a paper we did to study the effects of the Ethiopia's productive safety net program on food security in Ethiopia. So many the speakers who spoke before me went through this, and for this crowd, for this audience, probably motivating this paper may not be necessary, but I'll just quickly power through this. So as we all know, the COVID pandemic has been testing global production and food and social protection systems. And to give you a sense of the scale, so a recent projection by the World Bank estimates that between 110 and 150 million people will fall into extreme poverty by 2021. And there is similar negative projection by WFP that estimates up to 135 million people will face acute food insecurity. So we expect COVID-19 to impact food security in at least 3 ways. One is the direct exposure to the virus itself. Kind of people contract, household members contract the virus, and as a result, their participation in the labor market is reduced, and the opportunity to earn incomes is also lowered. And even absent that, even without contracting the virus directly, the fear of contracting the virus and the various government restrictions put in place to reduce the spread of the virus are going to reduce income generating opportunities. The final of those 3 channels is disruption to markets and food value chains. So in these circumstances, social protection programs could play a critical role, but we know social protection programs are very complex to design and expensive to implement. So as a result, developing countries are expected to suffer the most from the ongoing COVID pandemic. But more recently, there has been recognition of the role of social protection programs in mitigating the impacts of such large-scale shocks. And in fact, according to Gentilini, who seems to be cited by everybody on this in today's presentation, notes that more than 200 countries now have put in place some form of social protection measures, many of which being a one-off cash transfer. But we don't really know much about the effectiveness of the various social protection programs that are being put in place. So that's where this paper comes in. So we ask 3 simple questions in this paper. The first one is, what are the impacts of COVID-19 on household food security? I'll talk about the various household food security measures we use in this paper a little later. The second question is, we try and see if PSNP participation in the Ethiopia's social safety net program mitigates the impacts of COVID-19 on food security. And finally, we try and see if there are heterogeneity by socioeconomic groups on the impacts of PSNP in protecting against the malign impacts of food security. So to answer these three questions, we focus on Ethiopia's flagship social protection program, the PSNP, and it is one of the biggest such programs in Africa. I believe it is the second biggest in Africa. And for this purpose, we combine a pre-pandemic data, which was collected, a pre-pandemic face-to-face survey with a post-pandemic phone survey. And we cover a range of outcomes on households, mothers, and children. So let me give you a bit of background on Ethiopia's social protection program. So the PSNP, as I mentioned earlier, is one of the biggest in Africa, and it's been operational since 2005. It was put in place in response to recurrent food shortages in Ethiopia, and it's meant to give a predictable transfer to households that are food insecure. And the program has a dual targeting design, geographically and at the household level. Geographically, it operates in waradas. Waradas, you can think of waradas as being equivalent to districts that are chronically food insecure. And within these chronically food insecure districts, households that are food insecure are targeted for intervention. So the inclusion criteria, there are a range of inclusion criteria, and these include household food security status, asset holdings such as land and other assets, income, the capacity to generate income from alternative sources is also taken into account in selecting households into the program. In terms of modality, so a big chunk of up to 85% of the program is of the public works type, but there is a small fraction of households beneficiaries that receive unconditional payments, and these are the elderly, so households whose main income earners are elderly or disabled. So a large chunk of the transfer is made in cash, but there is a small amount of in-kind payments as well. So 73% in kind, and the rest in kind payments, food transfers, pretty much. So beginning in 2018, new activities were added meant to make the PSNP more nutrition sensitive. This aspect of the program is important for our study. So to give you a bit of context on COVID-19, so the first case in Ethiopia was confirmed in March, and this has triggered a range of government responses, including domestic and international travel restriction, closure of schools, universities, etc. And this culminated in declaration of state of emergency in April 2020. So as of today, we have approximately 130,000 confirmed cases and about 2,000 days. So in our survey, we ask people, so the relevance of this paper, the research question we try and answer relates to whether or not COVID-19 has been destructive to the livelihoods of people, and we ask pointed question of our respondents in the survey. Almost everybody knows about COVID-19, and we ask people how they are feeling about COVID-19, subjective well-being question, and some 68% say they are extremely worried about it. So let me give you a bit of some info on the data and method we use. So as I mentioned earlier, in August 2019, we conducted face-to-face surveys in 88 waradas. As I mentioned earlier, so the focus of this study is on in regions, in waradas or districts where the nutrition sensitive component of PSNP was implemented. PSNP is operational in over 400 districts, but we focus on those with the nutrition sensitive component because we're interested in nutrition outcomes of mothers and children primarily in this survey. So our sample analysis consists of mothers with children that are under 24 months old at baseline, that is in August 2019. And to be included in our survey, they have to be either part of the PSNP, that's PSNP beneficiaries, and if not, they have to be considered poor by community standards. I can talk about the details of this criteria a bit later if there's any interest in this. So we conducted follow-up survey in June. So because the follow-up survey is phone survey, obviously we can't really reach all of the baseline households, because in this population, phones are important measures of wealth. So there is a selection issue, obviously. We'll try and, I'll briefly talk about what we do to address this concern. So our empirical strategy is a basic difference in difference specification, but because of the selection issue I mentioned earlier, we account for this by constructing weights. So the weights are pretty much the probability of being selected based on observed characteristics. So I don't show it here in this presentation, but we have a detailed table in the paper that shows that we attain balance between treatment and control once we use weights. So let me give you some results. First, descriptive results, then I'll move on to our regression results. So in terms of food security dynamics, we asked people which aspects of coronavirus affected their lives. And as you can see in this figure, in figure 1, so market closures and being sick or fear of getting sick are the two most important ways in which COVID-19 affected their livelihoods. And some 50% of our sample households report that their food security status had worsened. So here food security is measured in terms of households' ability to satisfy their food needs. And we separate this by COVID exposure at the zone level. The zone would be the next higher administrative division in Ethiopia. So we have country, region, and zone. Zone would be above the district level. So we put together data on number of COVID cases at the zone level, and you see the food security situation deteriorated significantly in high COVID areas compared to low COVID areas, which kind of gives us confidence that we have a COVID story here. So one final descriptive result here. So our food security outcomes. So we have two measures of food security. One is a simple dummy variable that measures a household's ability to satisfy its food needs. If in the last 6 months, a household had any issue satisfying its food needs, then the dummy variable takes 1, 0 otherwise. The second measure of food security is food gap. Food gap is a measure of the number of months in which the household had difficulty to satisfy its food needs in the last 6 months. So it takes value between 0 and 6, sorry. So as you see for the full sample, in baseline 2019, a little over 50% had difficulty satisfying their food needs. This has gone up to about 60%. But this is primarily driven by the non-PSNP households that are not beneficiaries of productive safety net. There is a small increase for PSNP beneficiaries, but not so much. But so bulk of this change is coming from non-PSNP households. You see, it goes up from 49% to about 61%, approximately 12% increase for non-PSNP households compared to a little over 1% for PSNP households. In terms of food gap, kind of the extent of this exposure, you see at the baseline, households had difficulty to satisfy their food needs for about 1.3%, 1.3 months. This has gone up to 1.6 months in the post-COVID period. And you see there is difference between PSNP and non-PSNP households as well. So this is again significantly driven primarily by non-PSNP households.
2 minutes left.
Yeah, okay. Now let me give you our regression results. So these are our main results. You see that food in the following COVID pandemic, food insecurity increased by 12%, but PSNP participation erases about 9% of this increase. That is, PSNP participants are 9% less likely to be food insecure compared to PSNP participants. And in terms of number of months, for non-PSNP participants, the increase in food gap is about half a month, 0.47 months. But for the PSNP participants, this is 0.34 months less. So this shows us that PSNP played an important role in protecting households against food insecurity. So heterogeneity. So we try and see if there are heterogeneous outcomes by poverty status, the protective role of PSNP by poverty status, and we see that it is bigger, the impact is bigger for poor households. So in fact, for poor households, participation in PSNP almost completely erases the impact of COVID-19. There is some impact for non-participants, for non-poor households, but not enough to offset the impact of the pandemic. Likewise, for remote households that are households living more than a median distance from cities of 20,000 households. So you see for remote households, the impact is bigger, the protective impact. It almost completely, actually it completely erases the impact of COVID-19. But for non-remote households, there is protective impact, but not as much as the remote ones. So the final, to summarize our results, so we find that food security deteriorated in the post-COVID period. As I showed earlier, about 50% report that. The most important aspects seem to be market closures, increases in food prices, and loss of income. We find conclusive evidence, conclusive evidence that PSNP plays a protective role. And we find that this protective role is higher for poorer and remote households. And this gives us this is not an interesting suggestive evidence that, at least in the context we study, in-kind transfers have greater impact. We say so because by design, PSNP provides in some of the very remote areas in-kind transfers, but elsewhere, as I mentioned earlier, the main modality is cash. So the fact that the impact is bigger in this remote area seems to suggest maybe in this context, in-kind transfers have had greater impact. But we will be careful to not generalize. So in terms of lesson learned, because of the context of, because of the nature of our survey, we are not able to say conclusively whether cash or in-kind are better. But in situations such as COVID-19, where the onset is pretty quick, there is some evidence that cash transfers are more efficient because they can be expedited, quickly delivered to the beneficiaries. So in terms of more recent evidence related to COVID-19, a report by the World Bank, a very recent report by the World Bank, the Economic Inclusion Report, shows that larger programs and programs that are led by government have been more effective in mitigating the impacts of COVID-19, simply because these tend to have an existing structure that such transfers can flow through. And as I mentioned earlier, the main type of transfer has been cash transfer, and it has been effective somehow. But because many of these have been one-off payments, they have not been fully effective in offsetting COVID-19 impacts. So that is it from me. Then we can discuss more if there are any questions.
Yes, thank you very much, Kibron, for the good presentation. I really like that. It seems to be that the PSMP is working, no? And also in the crisis, and is protecting, in particular, the very poor. Yeah, thank you very much for the presentation. And yeah, as the time is flying, I would like to start with a question and answer session. And I would like first to ask all the speakers to turn on their cameras. And I hope that the connection will allow to see them. And then to all participants, if you would like to ask a question, this is now the chance. So you also can use your virtual hand that you can find when you hover, I think, over your name. You can find your virtual hand, and then please raise your hand, and then we will unmute you, and then you can ask a question directly to the speakers. And I would kindly ask you to introduce yourself first, and please be brief with your question, because we have only limited time. And of course, we have now collected many questions from the, also there have been many questions in the chat. We will now also try to mix it. So there will be some questions from the chat and some questions maybe from the raised hands. In any way, I just would like to say that there will be no unanswered question, or we will try to forward all the questions also from the chat to the different speakers. And yeah, maybe we can start with the Q&A. Yeah, I can see you all great. You have turned on your camera. Maybe we can start with some questions from the chat, because I do not see currently virtual hands raised. Maybe I will start with Gariba, because you have also started first. We got some different questions also to your presentation, and one of the question is, why do you think that there was no impact on the medical access? Is maybe the medical access is already, is medical access for free and good because the pensions have been enough? This would be one question. And then there was a question on the current extreme poverty line in Tamil Nadu. A participant said that it's roughly around $57 US, and the old age pension seemed just to cover 80% of that. And do you think that is that a problem, or how does it affect your results? So you think it's a kind of that your results maybe are underestimated, or yeah, this would be the two questions.
Yes, I hope you can hear me. My internet connection is very bad, so I can't see you, but hopefully you can hear me. Okay, great. So with respect to the first question on medical access and why, of course, we don't know exactly why there weren't positive effects on medical access, but there are some clues, right? So to begin with, access is over 80% among both the OAP treated as well as the control group. So because baseline rates are quite high, there's less room, I think, for improvement there. I think the variable that we really care about is illness and symptoms and mortality. And those are things that we're exploring in the current sample. So I think we'll have a much better sense of what were actual rates of contracting COVID, actually suffering from illness, etc. And I think that's the thing that we care about more, but we don't have those measures yet. With respect to the poverty line, yes, Erin is a co-author on the paper. She's right that it's about $57 a month. And so the old age pension is about 80% of the poverty line. And in terms of our treated households, it's over 50% of their monthly per capita consumption. So it's a substantial transfer. It's not a small transfer for these households.
Okay, thanks. Yeah, we have a very good or very interesting question to Christian's presentation. Somebody would like to know, first I have to check if there are any hands. Otherwise I will watch hands. Otherwise I will continue with some questions from the chat. I think there are no virtual hands so far. Yeah, one question to Christian. It's a bit about, I think what you also have said at the end, that you were also interested on the gender effects, and there's a question: what is the gender impact of the program? Simply participation of women, but in real change in their income and also in emancipating their social position. And then there's one question also to start to show that the payments for the Rega are often delayed, and this is probably also varies by district and could be related to the bureaucratic efficiency. Do we have access to such data to investigate more how much of these non-correlation could have to do with low capacity of the implementing bodies?
Yes, thank you very much. These are very good questions, and those we have also thought of before. To start with the wages question and delay wage payments, it's really a burning issue. Even before COVID started, there are many reports that wages are not paid on time. And I've done myself field work in Andhra Pradesh, and there's actually a PhD paper of mine, not published, but where I actually look at that and how the delay in wage payment is so counterproductive. And people sometimes have to wait for more than 1 month or two to receive their wages. But it's really a problem, and there are many activists on the ground who advocate for better payments. And interestingly, electronic wage payments and all the fancy technologies that we have, they may not actually contribute to faster wage payments. They might actually increase the delay. But that's a different topic, and it's a very interesting one. I think Larima's co-authors, they have done a paper on that. I think they have studied in new technology in Bihar, if I'm not wrong. Yeah, so that is really an issue, but unfortunately, we do not have, as far as I know, we do not have the data of the wage payment, and so we cannot really calculate the data that is online that is used from the NAREGA website. But it is sometimes possible through surveys to figure out that the actual delay on that. But you can correct me if I'm wrong, if there's more on the website. On the women empowerment, indeed, my co-author Sudha, she has written on that how this employment guarantee is really very beneficial for women to raise their status and basically lead to women empowerment in different ways. And that has been shown many times, and especially in southern India, the participation of women is more than 50%, more than 60-70%. And now what we have noticed, unfortunately, with the expansion of NAREGA, is that the percentage, the share of women in the workforce has dropped due to the influx of migrants that have come home. There may have been a shift in who works where and who takes up what role, and this may have then led to less women empowerment or to the depowerment of women.
Okay, yeah, thanks. Yeah, thank you very much for answering the question there. I think also COVID-19 will have some impacts, gender related impacts. No? So you can see that also in different countries, and it would be good to know how it will be in also in India. I will turn next to Kevin. There are a couple of questions also to your presentations, and one question is a bit like, first of all, where does the unconditional cash transfer come from? I guess it's not a general government program, no? So it's a kind of cash transfer experiment. And yeah, there's a question about the financing, like has it been financed by Yale or, but and then there's one question that I found also very interesting, like whether the bottom lines of it's a bit a question. So we have seen now from your paper that when the firms, the small businesses receive cash transfer, that their profits will increase. But the question is a bit like if the poorest firms also remain stable over the years, no? And the question is like, did you do some kind of researches at the beginning and at the end of 2020, and not, or have you just focused on March and April? Because it would be good to see this kind of, let's say, longer term impacts of the cash transfer program. Yeah, maybe these are the two questions.
Yeah, sure. So I'll take the quick ones at the top there. So yeah, the cash transfer program was a program we ran ourselves, in the sense that it was not run through the government or anything like that. We were doing work on a separate project, and given the ubiquity of mobile money in Kenya, we thought, you know, this is a great opportunity to sort of go in and do this as the crisis is expanding. The money came from a variety of organizations, none of which were government affiliated, so just private grants and things like that. So we used, yeah, some money from universities, and then JPAL was involved as well. On the long-term impacts, I think this is just a fantastic question. It's something we're really, really curious about for two reasons. One, there is sort of a question about, even setting aside COVID for a second, there's a question about how big do these grants have to be if you believe in poverty traps, to push people out of poverty traps, to generate these long-run changes from short-run, you know, transfers. But of course, now I think one of the things we're seeing is that, you know, if this is the true model of the world, now is exactly the time. You know, you're pushing people. I mean, profits are falling by 50% over the course of 4 months. And so you might very well expect long-run implications from having to close your firm. And another thing I didn't show you, but the fact that you're selling down all your inventory and you're liquidating capital to pay for food for your family. That's exactly what we see in the data. So I think it's a great question. We're going back in the field next month, and then we'll hopefully do a few longer run follow-ups over the next year to be able to answer that. But I don't think we're quite far enough along in the process yet to say anything fundamental.
Mm-hmm. Yeah, thank you for the answers. I just would like to remind everybody that when you also can ask questions directly, you know, so you just have to raise your virtual hand. I already have seen that there were some discussions about that also in the chat. So please, we don't have to use only questions from the chat. So if you are interested in any topic, or you have any questions, so you also can put it directly to one of the speakers. There's a great question from, I think it's to all of the speakers, from Armin Bauer. I don't know, Armin, if you feel you also can ask the question by yourself. So we will unmute you, and then you can put the question to all the speakers. Okay. Then otherwise I will read out the question. Yeah, so the general question is like it's a bit like yeah, it's a kind of general question on social protection, and maybe I would like to hear like from all of you what you think. So 19 will be over at the end of 2021, and not its poverty effects, but let's say the health crisis. And the question is a bit what changes needs to be made to the social protection systems of countries going forward, and what can we say a bit about the key topics like unconditional cash transfers, conditional cash transfers, public works programs, livelihood support, and also financing of small and medium enterprises. So what would you think, what needs to be changed with regards to the social protection systems? Also, we also had it as a kind of guiding question, like that in particular people from low and middle income countries become maybe more resilient in the future. And yeah, maybe we can start with Kibrom. Kibrom, because yeah, you had until now not the chance to answer any question.
Okay, thanks for an interesting question. So I think so what has come out of this episode, COVID-19 episode, is the biggest part would be public opinion towards social protection programs, right? So one of the challenges in putting together such programs or scaling them up has been perception, public perception. Now that we have faced this pandemic that had a broad reach, like across spectrum, across income groups, social classes, so there is now, I believe, greater acceptance that such programs are useful, because the evidence that we are now beginning to see is, even though granted the evidence so far has been short-term impacts, because of these positive impacts, long-term perceptions will change. The other benefit, it's just I hate to use the term benefit, but advantage of the experience of the last few months is because of the situation that has forced governments to put together something in place. Even after COVID-19, there will be structures for implementing social protection programs. Now, in terms of what types of social protection programs are most effective, I think the jury is still out. We don't have enough evidence. Much of the evidence that we see these days that are beginning to come out are mostly cash transfers. There is some work on UBI, but it is mostly cash transfers. I only know of 2 studies that look at big programs, such as the PSNP. One is ours, the other one is a work by Arndt and others in South Africa. And both studies find really huge impact. So for me, the takeaway is it is useful to have a working social protecting programs in place when such large scale shocks hit. I think I've addressed the points. If there is anything that I've missed, just
yeah, no, yeah. You have addressed it. Thanks. Thank you very much, Kibram. Maybe Christian, you can maybe follow up, like especially you also have looked at, so current social protection structures are already in place in India, but your paper shows a bit that yeah, they really struggled with the adoption of the the employment guarantee program. Maybe you can reflect on that a bit, and then yeah, what is your take on that? So what should the Indian government improve maybe in the future? And yeah.
Okay, thank you. Well, I advise the Indian government. I think therefore, in terms of just the expansion, I think that was already quite impressive. However, what we found was that, and since Kibro mentioned targeting and the other papers, of course, as well, it could have been perhaps better targeted, but it's a little tricky since it's a demand-driven program in theory, and in theory, this should be all determined by demand. But we've seen, and that alludes to one of the questions, that some districts and some states may be less equipped to, or less capable of implementing the program, and there may be many reasons. It could be political reasons, there could be capacity reasons, all sorts of different obstacles. So, of course, when we see how beneficial the NAGA can be, of course, I would suggest, if I had the chance, to expand the program even further, especially in the poorest states and districts of Bihar, UP, Jharkhand, and so on, and increase it even further where it's already going well, let's say in Andhra or Chhattisgarh. So that would be my recommendation. And there are others that are linked to the question of improving obstacles such as delayed wage payments. To improve, then the overall wage could be increased, and it could be actually extended to 200 days, or as initially thought of, for the entire year, and it will then be determined by demand. And that, I think, would be ideal. And that, to answer the question you had for the other speaker, I think in general, universal programs are the need of the hour, and we've seen in so many places how good they can be. So this universal, it's essentially a universal program of work. We've seen in Tamil Nadu universal access to schooling and health and midday meals and so on. This is very, very beneficial in so many fronts. So universal access to health and education, I think, are key, complemented with employment guarantees that can go a long way.
Thanks. Yeah, sounds good. Thank you for your answer to this very general question, and also yeah, showing that India is, of course, also a very a complex setting in a way. And I would maybe pass the question over to Garima, because she knows maybe the Indian context also very well, and because Christian, he has talked a bit about universal systems, and there's also a very big debate about old pension schemes, old age pension schemes that also maybe suffer less from targeting problems that other social protection instruments have, like cash transfers and so on. And they also, yeah, seems to go more into the direction of universality. So you have this kind of categorical targeting. And do you think that this is maybe the way to go in the future, in order also to improve the resilience in the future for poor and vulnerable households?
I think this is something that Kibrom also mentioned, right? It seems that both in India and the Bolivian context with the pensions, that it was very useful to have the system already in place. The purpose of the system, of course, was to deliver pensions, not to deal with crises, but that having the system in place was very useful to then later target people who we knew to be particularly vulnerable during the crisis. I don't think this is just true of pensions. It's also true of systems like the UI system, which in the US, I think, has been quite effectively employed in quite a similar manner. I wanted to say something else, which is I have also worked on the TUP program in India, and I know that Abhijit has worked on UBIs in Kenya. And there it seems that households, when they're deciding what to do with these large transfers that are made to them, are of course not anticipating shocks, right? And as they should not be. So those types of programs, I think the purpose of those might be different. It's to alleviate poverty, and that's necessarily going to involve some diversification of household activity, probably into business enterprises, which are riskier. I don't view the goal of those programs as being to deal with emergency situations. It seems that having a system in place that can basically transfer cash and resources to people during times of emergencies is the way to go. And I don't think those types of programs should necessarily be viewed as being for emergencies.
Yeah, thanks. Yeah, this would call for adaptive social protection schemes in a way, no? So that can be in times of crisis. Yeah, this is also maybe related also to Kevin's work, like, because your experiment is mostly in the informal, or is in the informal sector, no? So, and it's a question what do you think, how to cover them, how to achieve that, no? That we have schemes there that also can be adapted during times like pandemics or other crises.
Yeah, it's a great question, and one of the benefits of going last is that everyone who's already said things are things that I completely agree with, so I don't have to say that much. Right, so I think, so the thing, I'll try and frame this a bit more in cash transfers, building off some of the things that Kibram said about putting the structures in place during COVID, and what Garima said about sort of what the role of something like UBI is relative to short-term social insurance. So the thing about COVID, I think, is that it's such a clearly well-defined negative shock. Like, we all know that this is a problem, and we can therefore create policy around it. Maybe we haven't gotten there yet, but we know that it's a shock. In a non-COVID time, thinking about social insurance is not going to give us this clarity of what the negative shock actually is. And that's really important, especially when you're thinking about the informal sector. So if I'm somebody working informally and I lose my job, the government has no idea that I lost my job. It's not like the US where I can just look through the IRS database and figure out you lost your job and then transfer you money. And so that to me is sort of the big trade-off here. There's sort of like, at one extreme is UBI, which I agree with Garima that it's probably not the right policy for thinking about social insurance necessarily, but that's one way to go, in the sense that you just accept that it's hard to figure out where there's a negative shock, and so you just say, well, I'll just deliver the cash in all periods and just forget about that. But I think the other thing that Kibram was pointing out about these structures is that I think going forward, one of the things we're learning is that we're going to need a way to bring these types of people into, I don't necessarily want to say the formal sector, but some structure by which the government can make these transfers and get a little bit more information on people. And there's been plenty of research about trying to formalize firms and digital identification and things like that I think are going to be really important going forward as we try and deliver these things. And I personally don't have a great sense of where we need to go next, but I think without them, we're going to be sort of stuck flailing around a little bit as it comes to delivering insurance to these people.
Yes, thanks for the answer, and for the one idea maybe would be also to build up, and I think it's also planned to start building up more social registries, and in order to have the chance to include more of the informal sector when there are shocks, large covariate shocks. We are almost at the end of the workshop, and I'm very happy that we had you as for distinguished speakers, and we really could talk, I think, about a variety of different social protection instruments and topics. And I'm just looking in the chat again if there's any questions. So there are many questions that we have not raised until now. So we, as I said, we will forward them to the speakers, and then the speakers will answer them. No? So there's no question that will. Hopefully, there will be no question that will be asked. And yeah, I would like to thank you, and it was really great of having you here. And yeah, from myself, I really enjoyed your presentations, and to see this evidence that in some of the cases, yeah, for example, the PSNP, it seems to be very protective also in times of COVID-19, and also like a lot the other presentations, no, on the different impacts and effects. And yeah, I would really like to thank you. I really enjoyed your presentation. And secondly, I also would like to thank all those that have participated now in the workshop and also have contributed to the discussion and also have asked questions. And then I also would like to thank the organizers, like in particular PEGNet, who jointly have organized the workshop with us, the German Development Institute. And yeah, before I close the workshop, I would still, yeah, I think it was already also mentioned by Rainer at the beginning, that there will be two upcoming events. The first one, Rainer has mentioned, is the annual PEGNet conference in fall of this year. And then we also, the German Development Institute will also organize a workshop soon in 2 weeks, jointly with the Friedrich Ebert Foundation and the ILO. And we will focus a bit in this workshop on the COVID-19 impacts on the informal sector in sub-Saharan Africa, and also we'll discuss social protection responses. And yeah, here we will present latest research of our institute. And yeah, please check also our homepage for the date and how to register. Yeah, and again, I again thank you for participating in the workshop and presenting your work. And yeah, there was a request in the chat. I just read that if it's possible that you can share your working papers, that we can share them also with those that are interested, of those participants at the workshop that are interested. This would be really great if you can share them with us, and then we will distribute your papers, of course. Yeah, okay. I see a lot of nodding heads. Okay, this is great. And yeah, and yeah, thank you. And for the workshop, and I wish you a great day. And I don't know if anybody would like to say, like Rainer or somebody from PEGNet would like to make some ending words. Otherwise, I will. I wish you a great day and a good weekend ahead. Thanks.
Thank you so much.
Thank you.
Thanks for the invite. Thank you. Thanks so much.